Let's bring him in. He's our good friend who's been with us on the morning show on WAKR for over 25 years. And that's Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital, diving into the world of sports medicine. Good morning, Dr. Joe, and what do you have for us today?
Hey, Ray, I like so many other sports fans around, are really wondering, have we seen the last of Aaron Rodgers due to injury? And the injury, of course, that he had was to the Achilles tendon. And this tendon injury is kind of the death knell often for athletes, for older athletes. Some are able to come back. We'll give some statistics on that of what we know, but it's a really tough injury to come back from. And wow, to see it that early in a game like that, of all the ballyhooed return of Aaron Rodgers. Almost every week in pro sports, but this week also J.K. Dobbins, who's a friend of Ohio State and has had a very injured career so far with the Baltimore Ravens. He tore and ruptured his Achilles too. And so Achilles tendons I wanted to talk about a little today. Everybody's talking about it down in the sports medicine world. The Achilles tendon, Ray, it's the largest tendon in the body, and it's the power generator from the heel through the calf. And with every step we take, any power that we have in our movements comes from the Achilles tendon. It's the largest tendon in the body, much more so than the patellar tendon below the knee or the rotator cuff tendon. It's a pretty important tendon. In sports medicine, I had a talk last night just to go over some of the surgical issues with one of my sports surgeon partners, Dr. Kerwin Jones, who's an awesome surgeon, mid-career guy, takes care of the Copley Indians. And Kerwin, early in his career, doing a lot of Achilles tendon ruptures. I didn't want to miss anything. Went over some things with him about it. The thing about the Achilles tendon is it doesn't happen very frequently less than 20 years of age. So with those of us being in pediatric sports medicine, I in an entire career maybe have only seen 5. And Dr. Jones, pretty similar since he's been in pediatric sports medicine. Not that many Achilles tendon ruptures. Interestingly, one of the best athletes in town last year happened to rupture their Achilles. So it does occur in young athletes, but typically it starts coming on the scene mid-20s, but more so 30s, 40s, 50s, and it becomes very, very common in those age ranges. And many of us know people who have had Achilles tendon ruptures. And the tough question then, Ray, becomes, do we fix it or do we try to treat it through healing and rehabilitation? And it's kind of tricky. For anybody who's a high-level athlete and where athletics is really important to them in that age range, they're going to have it fixed if they're going to have any chance of getting back. But for recreational athletes, some of our runners, golfers, they might consider treatment without surgery. And treatment without surgery, the surgeons put the foot into a pointed position to try to tighten that Achilles and get it to heal back in a tightened form. Because if it heals at all with gapping, what we call it, or looseness, they're going to have a power outage. They're just going to always lack that power if they try to heal it without surgery. And even when the surgeons fix it, they try to fix it nice and taut so that you get that power back in your gait, in stepping, and so forth. And so that surgery is a big deal. It occurs in a lot of different things. Boy, a lot of my friends and people coming back from Florida and stuff, I was hearing in the last year or two about it becoming kind of a pickleball injury. It's a lot of people getting off the couch and the chairs and starting to play this seniors game called pickleball. What a great thing to get active again. But there was a lot of talk. I didn't see a lot in the literature yet. They said, yes, there was an increase in pickleball, like tennis, coming to the net, pushing off, and you feel that pop, and you rupture your Achilles tendon. So that's the problem area. There's also a connection with some medicines, definitely with anabolic steroids. Not as much anabolic steroid use as there used to be, but we almost used to know that if somebody young was using anabolics and they ruptured, that there was a connection between the two. Corticosteroids for medical conditions or injections, almost everybody knows, don't inject that area anymore. You're really running the risk of rupturing the tendon. And there was some talk lately about Accutane, the skin medicine that a lot of young kids and teenagers take. That hasn't been proven for rupture, but it does lead to Achilles tendonitis and calcification of the tendon, which could lead to the tendon problems later. So just a thought about Accutane. But the big thing is that NFL study I was mentioning. It was a 6-year study, and it's ongoing. But they have found up to now 57% of NFL players who rupture their Achilles are able to return to play. That means about 40% never return to play. So it's about 40-60, Ray, are able to return. And the number one position to be able to return are tight ends, 71%. The number one position to not be able to return, wide receivers, 38%. So also the younger the athlete, the higher the chance of return, which works against Aaron Rodgers as well. So this wonderful quarterback that we got a long chance to see, well, the odds are a little bit against him right now about whether we're going to get a chance to see him play quarterback anymore. But that's kind of the long and the short of it of Achilles tendon. It's the powerhouse. And if we don't have that tendon, we have a power outage. We can't push off strong, and we lose a lot of our sporting activity ability.
Joe, I have a question pertaining to this Achilles injury, and I watched it happen with Aaron Rodgers, and you probably watched it and you see it differently than I do through the eyes of a doctor. But there's been a lot of speculation about the field turf, and did that have a role in this injury? And there's also been a lot of talk about MetLife Stadium, with their turf there being sticky and grabby to the toes and the feet and the ankles and that type of thing. Now, there's also a 270-pound guy coming down on him. But with a traditional Achilles injury, is it more wear and tear, or could it be something where the toe got stuck and then the force of the blow would have stretched that to where it did rupture?
That's a very, very good point, and that probably is the most common mechanism. As usual, you're all over it, Ray. That's the most common mechanism of how it happens. Now, no way in the NFL study are they going to start looking at specific stadiums. So I've heard the MetLife discussion as well, and I thought they were going to change their turf, but I'm not totally sure on that. I'll check that for you and see. I thought they were going to change their turf, but there were many different types of lower extremity injuries, and the Achilles would fit into that category at MetLife. They did not look at that at the NFL study, but they definitely, that's the mechanism, is the stretch of the Achilles tendon, and then a large person pulling on or landing on the leg and overstretching that tendon to the point of where it ruptures.
All right. Great stuff, Joe. As always, you're on it, my friend. Great insight, and we'll do it again next week.
All right. Have a great week, Ray. See ya.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joins us each Wednesday at this time here on 93.5, 1590 WAKR.